Welcome back to Dolor Factor Live. We are talking some serious emotional business tonight, okay? I have my two guests here. We've introduced them earlier, but for those people who have joined us late tonight, sit down, get comfortable, all right? Dr. Ben, I ask you first, what is your aim tonight? What would you like to get out of the show?
Well, first of all, let's get to reality and let's look at accidents, motor vehicle accidents in St. Lucia. Every year you hear the counting of how many people have died out of motor vehicle accidents. From a doctor's point, you think about what can you do? Can you save this patient's life if you are the one at the emergency room or you're the surgeon? If a patient, for example, if a person is in an accident and suffers a fracture of one of the bones, etc., well, we do have the surgeons, we do have the facilities, and they get operated, they survive. What about if this patient appears with a fractured skull? You see the signs that there is some brain damage, then what do? Now, we the doctors get scared in this situation. Why do we get scared? It's not that we don't have the knowledge to handle the case. If you have a neurosurgeon, he's someone who is adequately trained to take care of sick patients. But
what is a neurosurgeon?
Okay. Well, a neurosurgeon is basically a physician who is specialized in doing surgery of brain injuries, any problem that requires surgical operation to correct the problem. Okay, so that includes tumors, but talking about accidents, it's more about bleeding. Usually it's bleeding. Bleeding that leads to swelling of the brain, etc., and then the function of the brain gets lost, and that's how the patient dies. So the reason why it is a concern is that if I'm in the emergency room working, I used to work at St. Jude's ER for a couple of years, my fear is I don't want a patient to appear and they tell me, well, the patient is unconscious. And when I examine the patient, I notice, well, there was a severe impact on the skull, and I know definitely this is something that will require brain surgery. What am I going to do? Understand? So we can go to a certain point, but then we are cut short because of lack of the facility and the human resource to deal with such problems.
But presently, what we have to say, I have to be clear, because we have to be balanced in everything we say. From the very beginning, the government have always have an agreement with Martinique, so they can come in whenever there is a need. Like the last time, unfortunately, when our student got injured, there was the contact in Martinique right away. But the risk of having him travel was the biggest problem. And so we had no choice, and the doctors themselves were thinking about it. And when they decided what they were going to do, it was too late. He then, passed away. But the point is, there is an agreement, but we would like to have something here that we can say that we can manage the cases, especially now we're having so many accidents in St. Lucia. And we have to be very conscious of that. In the health sector, we need to be conscious of that. And I know the Minister and the Ministry of Health is very, very concerned about that. And this is where we need to focus. But we need to work together, both the private, public sector, others need to come in, and so that we can have that effort in making sure that we are focused on having the right things done. But there is a system right now.
Okay, we had some images on the screen, and I want to actually go to those images later, not right now, because I think it's very important that we understand why it is that we don't have these facilities. Why don't we have these doctors or surgeons? Why don't we have these facilities?
Simply, I better this one as a former permanent secretary. We definitely, with time, we are developing and everything else. Our specialty is now developing. And as you know, the world is getting small, and we have specialties, and our own people are going out now and train, and they're coming back. Like we now have doctors that are coming back, neurosurgery and so on. So we are saying with time, maybe we are a little behind, but we are catching up, and that is the point we have to make. So we have to take the opportunity right now to develop these specialties, and that's what we are doing. Basically, I think neurosurgery is probably one of the things we are lacking here, but we are well established in the other specialties.
Dr. Ben?
Well, I think Mr. McDonald has said it quite well. Definitely there is some kind of arrangement with Martinique where a patient with a brain injury that requires surgery can be taken to. But from the physician's point, the time is a factor here. We work with time, and there are certain conditions that we know we have to act immediately. And when you look at the arrangements you have to make to transfer a patient from St. Lucia to Martinique, or even sometimes to the US, you know, that is where we can lose the patient because of time. You understand?
What about money? Is
well,
it,
well,
they lose the
money
patient between because of time and money?
And money, fine, but I mean, if we have the facility in St. Lucia and there's no money, the point is when it's emergency, you know, a lot of times you just have to act to save a life. Okay, but if we have the facility here and there is no money, but we are not going to say there's no money, we are not going to operate. We're going to operate
some
and then
people
take care
think that that is why people pass, people are left to die. There are so many rumors out there, I'm just going to say it straight, right, that if you're a certain age, doctors aren't going to operate on you. If you don't have money, doctors are not going to operate on you. This thing about time, they say sometimes time is wasted, time is not used properly. Please enlighten us.
In fact, let me just say, I can speak for St. Jude's, and I know for a fact that we have some very good people as concerned, and our policy is, yes, the funds are necessary, because even now as I'm speaking, we have about budgets going on. But the point is that anytime there's an emergency, policy is that you must treat the emergency as it comes. Now, it's true, if you're well off in the sense, you can get things done a little faster, right? Because one call, you can get things done right away. But the point is, within government policy, you're going to be looked after. And that misinformation has to be cleared, that we will look after the patient no matter what.
Okay.
Okay. Well, and also when it comes to doctors not wanting to treat a patient because they are old, I mean, we do have our protocol, and we also, before we put a patient to go through surgery, which is harm, it is a harm to heal, we want to look at the pros and the cons. An elderly patient has a much greater risk of not going through the surgery successfully, and that means that they could die. And so we want to balance it. We want the best for the patient. So sometimes some surgeries may not be really necessary, but if it's a young person, for an elderly person, a young person, you may want to do it because they are young. But for an older person, you may cause more harm, and you probably increase the chances that they may not survive, or maybe have some other complication that comes because of the state of their functional level. So it's vulnerability issue. So I think a lot of times we probably maybe fail by not adequately explaining things to the patients, the family members, so then they can understand why we don't want to do certain things.
Okay.
And so the patients do make their own conclusions and assumptions, and that is what just spreads out, and then everybody just thinks, well, this is what it is.
All right.
Okay, so I think if we the physicians do a little more by giving them a breakdown, a thorough explanation as to what are the options, what are the pros and the cons, and let them understand why we are choosing this option.
But first of all, I know you want to ask something, but I'm burning to ask something as well, Doctor. How do you deal with people who just think, well, you are a doctor, my family is going to die. What you telling me about you have to take them to a neurologist or a neurosurgeon? You're a doctor, you save lives. Why can't you? Okay.
Well, we save life with our knowledge, but we need tools to do that as well. So well, I'm not a neurosurgeon. If a patient comes that needs brain surgery, what can I do? If I transfer the patient to Martinique, well, that's fine. But other than that, I can't really do much.
And let me just mention
here, the patient has to be made to understand that you do not have the expertise, professional expertise, to handle that kind of case. And that is why we have to transfer. And if we can't get a patient there, then we have difficulty.
In my time, I've seen it so many times. When the patient comes in, of course, trauma. What happens? People are not in the right psychological frame and they are, of course, nervous and everything. And sometimes our own professionals, in other words, I'm going to get blows on that, but it's a fact. They don't take time to explain. And I think that's one of the issues on a professional side we have to look at. And this is part of the parcel that we have to look at and have time to explain somehow or the other. And at St. Jude's, we need to do that now, and we are doing it, and we're going to be doing it in the sense that we have persons that should be sitting down, for example, sociologists should be there at that time to encourage and let the person know exactly what's happening. So all that, we have to talk about the teamwork that we need in that health sector so that we can make it complete.
You know,
Very important.
I was told before we were doing this show that we have no neurologists and we have no neurosurgeons in St. Lucia. I've been told that, and people are just being told that, so they fly to Martinique as the nearest place. Can you set the record straight on that? Do we have adequate people, neurosurgeons here in St. Lucia, the people itself, as
From
opposed
my
to the
knowledge,
facility?
I think we have one, and now we have, well, Dr. Sidney, who's here, of course, he's licensed and everything. But it doesn't take only the professional. It takes the whole setting, okay? You must have the facility, number one, and you must have the staff, a supportive staff.
What is the facility? When you say you need the facility, what is that
For
exactly?
example, he can say, for example, neurosurgery. What you need specialized equipment and everything else. That's one. Then you need to be trained. The nurses that are supporting the doctor need to be there. So it's a package you're going to have, and that's what we're going to be talking tonight. What we need, do we have the surgeons here? But they can only do what they can do with the limited amount of resources they have.
So how do we
that
get
is the
this
problem.
money? How much money do we have to raise? How do we get this money?
Very good question.
Well,
That's the point.
I think we are not going to aim at a certain amount of money. I think any amount of money is always better than nothing. But to set up a neurosurgical, I would have been happy if the neurosurgeon, Dr. Sidney, was here.
Yes, and let's make apologies for
Actually,
him
yes,
because
yeah.
he
Because
was
he had to
due
be
to
at the
come,
meeting
and
and
there
then
was a
clash.
there was a clash and something happened. So
Yeah.
you know, I'm sorry that he couldn't be here.
Yeah.
But we're going to do our
Yeah.
best. Yeah.
So we definitely need a neurosurgical unit to start with, and that means that there's going to be like a ward, there's going to be a surgical operating room, basically for that, because the brain is such a complex part of the human body that if you have to open a person's skull and get into the brain and repair some damages there, you don't want to cause further harm. So that unit has to be, well, just like any operating room, but we want to be much more careful when it comes to a neurosurgical. An infection in the brain after you have done surgery can just be the cause of the patient death. Okay, so we want to make sure we have a unit that is well equipped with all the conditions that will allow the physician, the surgeon, to do his job.
We would like that, but what are we doing to get that?
Well,
It's
so
starting right
that's-
now. We're starting right now. And we're
that's
starting
what we
with,
came here
Okay.
you know,
for.
what's what,
Yeah.
and basically that's what the foundation is being set up in Canada and in St. Lucia when bank accounts are opening, and that's the wish of the parents, and you'll hear it, that where they're now putting in funds so that they can assist. Now, the point is that they have made the point that they'd want it to be in St. Jude's. As the chairman, I would bring it up to the board, and we have to agree with government, because it's a partnership we must have in these things to see where exactly it should be and where it should be located. Now, their wish might be St. Jude's, but when we discuss with government, we might decide, well, maybe it's better at the new National Hospital.
Yeah.
But basically, we would be focusing on the south, obviously.
Yeah.
Okay? But the idea is that we are working together, and that is the beginning of something. Now, it doesn't have to mean we have to have millions of dollars to start. Whatever we have, we can start, and then from there on, we move on.
All right, well, we're going to go to a break, and when we come back, viewers, you've heard, first of all, talk about the foundation. You've heard us all talking about raising money. When we come back, we're going to have some parents on the phone who's going to tell us something about what they've had to go through because there wasn't adequate facilities here to save their son. And I'm sure you're going to know who it is as soon as they start talking. So remain with us, support us, and we'll see you soon.